So this is video 1 of 2 for training for hair PRP injections. The first thing I'm doing is getting another glove. Is getting ready for the blood draw. If you're in Concord, you do a 30 ml tube. If you're in Keene, Plymouth, or Manchester, you'll do 2 15s because the centrifuges in those locations don't fit the 30 ml. And just make sure when you check the patient out that you record how many tubes were done. Like on checkout, it'll pull from the retail, if that makes sense. I have a 10 ml syringe connected. I'm gonna grab another 10 ml because you should, with 15 ml tubes, you should be able to grab at least 15 PRP. And I know we have extra of these little doohickeys, so I'm just gonna grab another one. Otherwise, you could just use the same one twice, obviously. But if you find an extra one, you can just set it up like that for speed. All right, so I have my tubes, I have my syringes. I like to use this numbing. So you're gonna go where the majority of the hair loss is and start there and then move outward so that you don't run out of PRP. So for most people, it's either here, obviously the crown, or on the sides. And I use this numbing, I really rub it in, and then I put a warm towel over, which I actually need to get rolling as well. So I'm turning on my steamer, I'm gonna wet my towel. And I like to warm it a couple of times. Like I put the numbing on, I put the warm towel on, and then while I'm drawing blood and preparing the needles for injection, I'll check the towel every once in a while, and if it gets cold, I'll put a new towel on. So I'm gonna wet 3 towels because I'll also keep a warm towel on. I usually start with half of the head and then do the second half. I'll keep a warm towel on that second half while I'm injecting the first half. And what I do is I rub in the prescription strength numbing. And just so you know, the numbing that we have from Empower Pharmacy that's stronger than our normal BLT, that BLT is over the counter strength. So it's not gonna cause any lidocaine toxicity. The stuff that we get from Empower, the extra strong stuff, can cause lidocaine toxicity, which usually starts with palpitations and anxiety. So I always double check with my patients, you know, do you have any heart issues? Have you ever been diagnosed with any arrhythmias? And if they have, I don't use the stronger numbing. And also, if you're going to use that stuff for microneedling for somebody who's really sensitive, you should really only do half the face. So what I would do in that case for microneedling is I would mix half of the Empower Lido with the 5% Lido, or the BLT. And just be cognizant of their heart rate while you're doing it and the way they feel. All right, so I'm gonna put these in the towel warmer. Perfect. So after I put this stuff on their head, I'll periodically spray it with this stuff. It's just 4% Lido, but it kind of keeps it wet, which then allows for the continued penetration. The warm towel opens the capillaries to allow for further and deeper penetration. And I have my blood draw kit, obviously. So we're gonna draw blood, spin it down, get the PRP, and then we're gonna mix it. So what I mix my PRP with is Lido with Epi, unless they have an allergy. Usually an allergy to Epi, as you know, is side effect, not allergy, but those that are sensitive, we do have some xylocaine without Epi, and if we have run out, just let me know. So I'm just getting my tubes ready. My Band-Aid. Okay, so you're gonna mix for every 2.5 mLs of PRP, you're going to mix 1/2 ml of Lido. So once I have the PRP in here, I use one of the transfer things, these, and I will mix in the Lido. So let me grab this. So I like to pre-do my syringes. Hi, I'm doing a video with the Lido in it, so I can just put the PRP right in there. Oops. I like to inject with 5 mLs because I feel like with a 30 gauge, that's about enough until the needle starts getting dull. All right, so this is xylocaine 1% with Epi. I took my 5 ml and I grabbed 4. Did I grab 4? 1, 2, 3, 4. Yeah, 4. So for hair restoration, I usually grab 4 5 mLs. I like using these 27s to reconstitute because otherwise they never get used. So I know you can use an 18, but you can also use a 27 if you want to use them up. You can save the company some money. All right, so this is 5 ml. So if we're doing 2.5 to half, for 5, it's like, I just do 1. You can do, 0.75. So about that much with, and then I'll fill the rest with PRP. So just stick that back in here. And actually, to maintain sterility, I'll just stick the 30 gauge right on there. So that's ready for PRP. So I'll do 4 of those. And then the second video will show how I inject and kind of do it in a little bit of a pain minimizing manner. But what you're supposed to do is blebs, subcutaneous blebs where the hair growth is desired, that are about 0.1 to 0.2 mLs every, and they're supposed to be like a 2 centimeter space in between each injection point. Very quickly you'll notice that you will lose where you're at. Obviously the epi will cause a little skin blanching, so you can kind of tell, but I like to be very deliberate about my sections so I don't get lost and run out of PRP at the end. So you just kind of move the hair around and do your injecting, but what I do is I also inject along the hairline, so I really make sure to cover the hairline with this, and I'll start at the hairline. I'll inject. And then a bleb of 0.1, let's say. And then I will physically move the bleb forward to my next injection. And I like to do 0.1 so that I can do this and get a little closer, because my goal is to numb the next injection. And that will minimize the pain, because this is very painful. So I'll show you what that technique is. But basically, now with my lidocaine all pre-drawn up, which typically you're not supposed to pre-draw, just so you know, because the person doesn't show up and you have to toss it. But this person I had contact with, and I know her, so I know she's going to show up. So normally I do this with the person numbing. But I have my 4, so I could have a total of, it's -1. There's 5 ml syringes, 4 of them, which is 20, -1 per syringe, so 16 mLs of PRP, a total that I can fit into these. And knowing that we have 2 15 ml tubes, which will garner maybe a total of 15 ml, 16 ml PRP, we're good to go. Usually I will review the tube with the patient and say, you know, there's not much I can tell from this tube, but one thing I can tell is the color is clear, it's not cloudy, which means your triglycerides aren't super high and your cholesterol should be near normal, or is not crazy high, I should say. It's not hemolyzed, which usually means an atraumatic blood draw. It's not yellow, so there's no jaundice, no liver disease, and it's not orange, which usually indicates they're on peridium. I think that's usually what I say. Oh, and then I review the red blood cells. So red blood cell hematocrit should be around 30%-ish. And so if it's like super high, I'm like, hey, I should have reviewed your record. What do you have? You know, what's your medical history? Do you have hemochromatosis? Is your red blood cell super high? Whatever. So anyway, it's usually normal, around 30%. I'm like, look, you have great blood cells. Or if it's really low, I'm like, hey, you look a little anemic. You should go see your doctor. Not me, because I'm not going to diagnose that. All right, so I have my tubes, those are all ready. I have my blood draw, I have my numbing. All right, I have my transfer, so that will transfer. This will connect to this and then to that, and so it'll maintain the sterility. So I'm going to leave that aside. This itself is not sterile. I'm sorry, it's sterile. So I'm gonna get a new one because that fell on the ground. All right, so the next video will be me actually doing the procedure.